Today, we're cracking open a real medical puzzle: why epidurals are so different during pregnancy. Picture this: a patient in labor needs an epidural. Getting the dose right is tricky, but why? So yeah, why is the dose so much lower for pregnant patients? Let's dig into the theories. Okay, so first things first, let's knock out a few common myths you might have heard. So is it faster metabolism? Nope, not really. The drugs we use for epidurals aren't affected. Okay, what about all that extra body water? It's a factor, for sure, but not the main one. Maybe the nerves are just more sensitive? Well, some research points to that, but it's a minor player. All right, so it's not metabolism, not body water, not even nerve sensitivity. So, what is it? The answer is all about anatomy. The actual space where the medicine goes gets way smaller. To really get this, let's do a super quick review of the epidural space itself. But how does pregnancy shrink this space? Well, it's this really cool chain reaction. Check it out. And this cascade of events is a total game changer for dosing the anesthetic correctly.
Think of it like this. Pour water into a skinny glass. The level shoots right up. Same idea here.
And we're not talking a small change. The dose has to be cut by as much as a third. So the key takeaway? A smaller space means the drug has a much bigger, more potent effect. But why is this so important? Honestly, it all comes down to patient safety. It's critical. So let's recap. It's a mechanical issue, not a chemical one. And knowing this is key to safety. It really makes you think, right? What other medical rules need a second look when the body changes this much?